Pessoal, estou aqui com o cardiologista Aseem Malhotra, que é o responsável pela implantação do Choosing Wisely aqui no Reino Unido. E é uma pessoa muito interessante, que tem um pensamento muito diferente do habitual. Eu vou entrevistar ele por 5 minutos só para saber assim da implantação do Choose Wisely aqui e também das ideias dele a respeito de medicina baseada em evidências e como pensar em termos médicos. Aseem, it's very nice to meet you, and it's a pleasure to talk to you. And we'd like to hear for 1 minute how has been the implementation of Choosing Wisely here in UK.
Yeah, well, we've just started the process a few weeks ago through an article that we published in the British Medical Journal. And this came from really the organisation that represents pretty much every doctor in the UK, the medical royal colleges, every speciality, if you like. The presidents of this signed up to it, realising that there's a big problem around medication, over investigation. Mm-hmm. And we wrote a paper in the BMJ to say that we were wanting to start a campaign in the UK to follow in the principles of choosing wisely, really to encourage conversations between doctors and patients for more informed shared decision making, but also to potentially identify commonly used treatments and procedures that should be reconsidered about whether they should be used. Now, to be honest, what we need to really think about as well is the broader picture, is that how have we got to this stage? Mm-hmm. And in my view, we have an epidemic of misinformed doctors and misinformed patients. The root causes of this include biased funding of research. So this is research that is designed because it's likely to be profitable, not because it's going to benefit mm-hmm. patients. Biased reporting in medical journals. Commercial conflicts of interest, defensive medicine, patient pressures, bias reporting in the media, and also an inability of doctors and patients to understand health statistics. So these are all the root causes of the issue. And if we're going to address this cultural change, which is what is needed most in healthcare, then we have to think about all of these various areas and how we tackle them. But ultimately, Lewis, this is about transparency. It's about greater transparency. When you have greater transparency, you have more accountability, and you have more accountability, then you get the best quality in healthcare, and that's what we need more than anything else right now.
So it's about the patient, it's about quality of medical procedures and all. And you were telling me yesterday that you are interventional cardiologist.
Yes, well, I train in interventional cardiology, yes.
And you became very critical of the way it has been done in the world and here. And you told me a very interesting story that how the idea of thinking differently came up in your life. Do you want to tell our friends about that?
Yeah, sure. So this is one of the things about how in our own minds as doctors, we have exaggerated the benefits of many treatments and in a way underplayed or downplayed the potential harm. So that's actually reflected in the way things are reported in medical journals. But one thing that really was a moment for me which made me really think about my own beliefs about what modern medicine can achieve was at a Mayo Clinic. The US physicians came over to speak at a London cardiology educational session several years ago when I was a more junior doctor, and this was an audience that were a good bunch of people that had done postgraduate training, were all in training to be cardiologists, and one of the lecturers put up a slide talking about the use of ACE inhibitors in heart failure or left ventricular dysfunction, and he said, what is the best answer to this question, which was essentially ACE inhibitors benefit everybody, or they don't benefit most people who take them with LV dysfunction. And most of the audience got it wrong. The actual answer was most people do not benefit because you have to look at the numbers needed to treat for one to benefit. Yeah. So that made me really think a little bit about how we do things in medicine. And then obviously every treatment has a potential harm. So then what happens, what we've been doing in medicine is that we often treat patients very prescriptively without having a shared decision-making conversation. Yeah. And we don't appreciate the side effects. And that's partly because of the way these are reported in medical journals and because we know the pharmaceutical industry scandalously, in some respects hide data on side effects and it's not reported. So all of this has contributed to a real problem in the Western world where we have people over-medicated. And you've got to understand in the United States, Peter Gosche from the Nordic Cochrane Center has said the third commonest cause of death is drugs, is medications.
Yeah. Well, it's very interesting. I think, don't you think we should shift a little bit the way we doctors think to a more of a probabilistic way of thinking? Because
Absolutely.
we are too deterministic. Maybe the clinical training we have, we are not. I guess that in med school we learn a lot of information, but we don't discuss how to think.
Absolutely.
Would you have an approach?
Lewis, you're absolutely right, and it's about transparent communication of risk. But you raise a very interesting point there, and that's about a cultural shift as well. And I teach my medical students this. When I teach, I tell them you've got to understand what we're doing as doctors, which is a tremendous, a great, altruistic profession. We won't go into medicine because we believe it's a very important, it's a social science. It's about improving people's lives. We are there to improve quality of people's lives, not just longevity. But what we fail to fully appreciate is actually medicine is more the art, practicing the art of probability.
Yeah.
Rather than it being an exact science. Now, of course, there are a few things that we can cure. A few, when people have infections, antibiotics are very effective in acute treatments. But a lot of modern medicine is about relieving suffering. And to relieve suffering, it doesn't mean you necessarily have to give a treatment. That relief of suffering, improving someone's quality of life, can be either through a lifestyle intervention change or just through a conversation. And I think that's what we had to think more deeply about.
Very good. I think the world in medical thinking need people like you that is able to think differently, to speak differently. And the example you gave, that professor was able to make you think, I believe you do this every day with other people.
Yeah, absolutely.
So congratulations, it was very nice.
Well, it's very kind of you, but I think it's a collective team effort, and we need to keep pushing this message. Because ultimately, it's about why we went into medicine, and it's to put patients' interests first, and that's what it's about.
Very good. Thank you.
Thank you.
Thank you very much.
Cheers.